new details from the Texas governor today on the status of the personal protective equipment the state has collected to send out to all of the hospitals. KLBK's Wes Rapaport was at today's press conference and has the details. He joins us live now from Austin. Wes?
Hi, Terry. I asked the governor whether he thought the federal government should take over the corralling and distribution of supplies here in Texas. He said the feds played an important role early on with testing and supplies, but now using the governor's supply chain strike force, the state is tapping into the private sector on a worldwide scale and reaping the benefits that he says he's aimed for. Governor Greg Abbott touting the work of the state's supply chain strike force. He says it has distributed more than 1.6 million masks, 200,000 face shields, 2.7 million gloves, and nearly 170,000 gowns in just the past week, with more in the works.
Basically, in this 1 week period that we're in right now, we will be receiving more than 5 million masks that we will be distributing across the state of Texas.
Gathering at a supply warehouse in Austin, state leaders say those supplies go to hospitals and other frontline healthcare workers first, followed by those who work in long-term care facilities, then other doctors and nurses.
I feel more confident now than I ever have with regard to access to PPE supplies, which is more than enough for right now.
Some in less urban areas, like Dr. Craig Ryan, Regional Chief Medical Officer for Covenant Health, are closely watching the flow of supplies into places like Lubbock.
We are using more PPE now because of the increased number of cases that we're seeing. So it's all about the ratio of inflow and output.
The governor teasing a possible announcement on the way to keep that personal protective equipment coming.
I don't want to get ahead of things because I don't want to announce it until I have it in hand. But knowing the information that I have and the visibility of what is coming in, Texas looks to be very well supplied.
All right, now the FDA has not approved any drug to treat COVID-19, but that's not stopping some doctors from experimenting with the drug used to treat malaria. It's called hydroxychloroquine. The governor says doctors are testing that drug on a group of 30 coronavirus patients in a nursing home in Texas City. They are on day 2 of several days of treatment. Reporting live at the state capitol, I'm Wes Rapaport, KLBK News.
Thanks so much, Wes.